The Omicron variant now accounts for 95% of COVID cases in the U.S. Public health officials say its effects are milder than the Delta variant, but Omicron's high transmissibility is still sending, large numbers of people to the hospital. William Brangham has an update from one particularly hard-hit state, Louisiana.
Thanks, Judy. Yes, the Omicron surge has just exploded across Louisiana. Take a look at this graph. In the middle of December, 196 people were hospitalized with COVID in the state. Now, over 1,200 people are. That is a six-fold increase in just 3 weeks. While this is still well below the number of people hospitalized during the Delta wave this summer, children have been particularly impacted during this wave. For more on all of this, I'm joined now by Dr. Mark Klein. He's the physician-in-chief at Children's Hospital New Orleans. Dr. Klein, very good to have you on the NewsHour. Can you just give us a sense of what you're seeing in your hospital? Who are the patients coming in? How are they doing?
Thanks for having me, William. We've been hard hit by Omicron. The amount of community transmission that's going on in New Orleans and across Louisiana is astonishing. And so we know that there are lots and lots of infected children in the community, as there are adults in the community with this virus. And our hospitalizations have gone up very dramatically from 3 children in the hospital for COVID just 2 weeks ago to 23 in the hospital today, including 3 in the pediatric intensive care unit. Many of the children that we're seeing who require hospitalization and more intensive care have underlying medical conditions, but about a third do not. They're perfectly healthy children otherwise. And so this is very much tracking like the Delta surge did over the course of the summer, where we see a lot of children sick in the community. Fortunately, most of them with relatively mild illness, recovering uneventfully in many cases, but a proportion of them requiring hospitalization and even intensive care.
We know that kids 5 and up now are eligible to be vaccinated. Are most of these kids in the hospital vaccinated or not?
No, I can tell you a snapshot of the 23 children who are hospitalized at Children's Hospital New Orleans right now is that none have been vaccinated. Kids 5 and older, of course, are eligible. The rate of vaccination nationally for children between 5 and 11 years of age is just 23%. And for children 12 to 17 years of age, it's about 60%. We're doing a little bit better there. But we have a long way to go for both the younger children and for the adolescents to get them vaccinated and protected. Here in Louisiana, the numbers are even lower. And so it's a very unfortunate thing. This is our ticket out of this pandemic. And we can almost assure that a vaccinated child will not be ill enough with COVID to require hospitalization.
Do you or your staff have the opportunity to talk to these kids' parents about why they chose not to vaccinate their kids or haven't yet?
Yeah, and it's a mix. There are parents who certainly express regret concerning the decision not to have their children vaccinated. There are others who remain adamant that they will not and would not, even if they had known their child would come down with COVID. I think for the most part, what I have seen over the past year is that most of the parents who are unvaccinated and the parents who have failed to vaccinate their children are not hardline anti-vaxxers. They're not this group that thinks that vaccines are evil or poison. They are people who have doubts. They're skeptical of the speed with which the vaccine was developed. They're worried that corners may have been cut. They're worried that there's just too little experience with the vaccine in children. But, we're dealing with this pandemic right now. Children are getting sick right now. And unfortunately, almost 1,000 American children have died of COVID already. So the time to protect our children is right now.
The CDC again reiterated this belief the evidence that Omicron does seem to be milder, certainly for adults and they argue for children as well. And that's led some people to think oh, milder means, okay, we can relax a little bit. It sounds like your experience is that that's not necessarily the right message.
Yeah, William, I hope that it's milder. I hope it turns out that Omicron is milder. I hope that it's not just wishful thinking. I think it may well be true that a smaller proportion of children infected with Omicron will require hospitalization. But for those children who do require hospitalization, I have not seen the evidence as yet that their hospital courses will be milder in some way. And I'm worried that we will still see children who are seriously or critically ill. And I hate to make a prediction like this, but I worry very much that we will see some deaths. And so, I always emphasize to parents and to doctors when I'm talking to them that, statistics are fine at a population level, and to say that children rarely die of COVID is true on a population basis. But if the child who dies happens to be your child, it's 100% for you.
All right, Dr. Mark Klein, physician in chief at Children's Hospital New Orleans, thank you so much for being here.
Thank you, William.